I've never used a capillary tube before, so that was very interesting.
Dietetics students were learning a new competency. They're learning how to complete blood chemistries using finger pricks, and this is going to be helpful for them if they go on to be a certified diabetes educator and they're talking to their patients about how to do a finger prick or showing them how to do a finger prick. So we're doing this project working with the MLS students. So our MLS students are the patient and the dietetics students are the ones completing the finger prick.
I thought it was very beneficial as a dietetic student working with these students because we're able to perform these tasks that we're going to be using in our field, and also kind of breaking that ice a little bit and performing some of these tasks and being more confident in my skills.
I think they were definitely a little nervous at first. I remember being extremely nervous my first time doing something like that. So even though they were nervous at first, I think the more that our students helped them through the process and the more that just everyone was being productive with that, kind of helping them, I think the less nervous they got and the more confident they became throughout doing that.
Working with a student I thought was very beneficial because we're going to be collaborating with other practitioners within our field once we get out into that clinical setting. So being able to collaborate with other students I thought was very, very interesting and cool. Very good experience. It definitely was a change of gears from working solely with food with something more clinical based, because as a dietetics student we're not only going to be working with food but also with the clinical side of things. So I thought that was very interesting and eye-opening to see that side.
In real life healthcare scenarios, there's definitely overlap with the work. So many of our lab results, can be changed throughout, just lifestyle, dietary needs and everything. So I think starting that at the base level here in school is very important to have kind of that connection going on into our actual profession in healthcare.
So it's a great collaboration for both programs. The dietetics students are learning how to complete that finger prick, and then our MLS students are learning it from another level, learning how to teach the FN students how to do that finger prick.